If you struggle with using a retinol, you get dry, peely, red skin, this video is for you. I'm Dr. Azadeh Shirazi, a board-certified dermatologist, and I'm here to give you unsponsored educational content because you guys are more than just a pretty face. You are informed, you are educated to make the best decisions for your skin when it comes to products and treatments. Make sure you stay until the end of the video because I'm going to share retinol staging, which is a technique I use personally and I teach my patients so that they do not get dryness and all the possible side effects of using a retinol. So if that sounds good, give it a thumbs up, make sure you hit the subscribe button, and let's get into it. So what are retinoids? Well, they're a class of ingredients that are vitamin A derivatives, and there are different forms of retinoids. There are retinols, retinol aldehyde, retinol palmitate, and then there is the most active potent form, which is tretinoin or Tazorac. These are prescription only, but retinol is a step behind the prescription version and it's over the counter. I have a more detailed YouTube video on retinoids specifically, but these chemical compounds, they bind to special receptors in the skin and they really make magic happen. They do so much for our skin. They boost our collagen, they protect our collagen, and recent studies have actually shown they boost our hyaluronic acid, which then helps with fine lines and wrinkles, but they do much more than that. They boost cellular renewal, which is a process that slows down with skin aging. And cellular renewal, when it's not being efficient, what happens is it can cause the skin to clog. So retinoids really stop the very first sign of acne formation. So they're very useful at treating acne because they stop the skin from forming that clogged pore to begin with. They also help with pores in general, making them look better and smoother. They help with skin texture. They also help block the activity of tyrosinase, which helps with hyperpigmentation. So we use it to treat discoloration. Not only that, but they boost circulation and just improve the quality of the skin. There's a lot of research and science that have backed up these claims when it comes to retinoids. In fact, it is the most researched, scientifically reported on ingredient, and that is one of the reasons why it's a favorite among dermatologists. I'll be honest with you, I have never met a dermatologist that was not using retinoids. So there's really nothing better for your skin than retinoids, but it's a tricky ingredient. It is very powerful. I call it the superstar of your skincare regimen, which means it doesn't like to share the stage with a lot of other ingredients. So one of the biggest mistakes people make is when they start on retinol, then they're also on these other products like vitamin C or glycolic acid or toners, these anti-aging creams. And when you start a powerful ingredient with all these other ingredients, you really run the risk of getting the side effects, what are the side effects of using retinoids? Well, one, it could cause dryness and peeling, particularly when you first start using it. It can also cause purging. So let's say you have a lot of skin congestion underneath your skin. Retinoids are great for that. It's probably the best ingredient for blackheads and whiteheads on the face. But when you start retinoids, what happens is because of that cellular renewal, all that congestion that's been buried deep inside your skin comes to the surface of the skin. And boom, you get increased breakouts, and dryness, and your acne can get worse. Typically that is temporary, but for some people it can be indefinite. And a lot of times it has to do with the way you are using the retinol. Again, you want to keep your skincare very simple when you're starting a retinoid. So that's really important. The second thing is a lot of people use it like a moisturizer. Well, you can't do that. It is a medicated cream. It is not a moisturizer. You're not like using tons of it and rubbing it all over your face like you would a cream. You want to use a very, very little. If you're using a serum, 3 to 5 drops is all you need. If you're using a cream, you just want to use a pea-size amount, very, very little. And some people say, well, I only use it twice a week. Why am I still getting dry? One, you really have to use retinoids 5 to 6 times a week to see the improvement and the changes in your skin, because that is the only way to get your skin to be what we dermatologists call it as retinized. And retinized skin is just higher quality skin. You have to use it consistently. That is the key. 5 times, 6 times a week. Otherwise, every time you use it, you're going to get dry. So when you're only using it twice a week, that's probably one of the reasons you're getting dryness and peeling, because every time you start the cellular renewal process, you stop it and you start over again. But not to worry, I'm going to teach you a technique that is going to significantly lower the risk of side effects. So what is this technique? I'm not going to gatekeep it. This is what I tell my patients. This is how I teach my patients to use retinoids in the office, and it works amazingly well. It's a technique called retinol staging. And what does that mean? It means that you're going to break up your retinol use in your skincare routine into 2 stages. One of the major reasons people get dryness and peeling is because that cellular renewal process that retinoids cause disrupts their skin barrier. The first stage is the hydration stage. This is when you are going to strengthen the skin barrier. You're going to cleanse and then pat the skin dry and apply a boring moisturizer. Okay, don't use Estee Lauder or like a Lancome, fancy anti-aging stuff. Boring. Keep it plain, keep it basic. I personally love Intense Recovery Complex for my patients when they first use retinols, because it is designed to calm the skin. It is very nourishing. It doesn't have any competing active ingredients, because again, retinols are the superstar of your regimen. They don't want to share the stage. Or you can use products like Avene has a sensitive skin moisturizer, Vanicream, La Roche-Posay. These are some other ones that are boring but effective moisturizers at hydrating the skin. So then, after you cleanse and moisturize in the first stage, you're going to wait. You're going to wait until later that evening, ideally at bedtime. So the first stage would happen somewhere between 5 and 8 p.m. And then the second stage would be kind of around bedtime. So 9, 10, 11, 12, 1 a.m., whatever your bedtime might be. So later in the evening, this is when you're going to use your retinol on its own. You don't need to clean your skin because you've already done that. You don't need to moisturize because you've already done that. You are going to use this powerful, potent anti-aging ingredient on its own, because that is when it's happier. Remember, it is the superstar of your regimen. Why is this method so effective? Because you are going into using your retinol with your skin in the best possible shape. It is hydrated, your skin barrier is strengthened, your skin is just much more readily available for the powerful effects of the retinoid. So not only is it making the retinol more effective, but it also helps reduce the side effects of dryness, peeling, purging. It is not the same as retinol sandwiching, which many of you may have heard of. Retinol sandwiching is when you cleanse, moisturize, and right after apply the retinol and then moisturize again. You sandwich the retinol in between moisturizers. So I have a problem with this, because when you sandwich the retinol, you're reducing its efficacy. And applying the moisturizer before and after, you're kind of diluting it down. So it's questionable how much of the retinol is actually getting into your skin and having any effectiveness here. With retinol staging, you are not reducing the efficacy. In fact, you are enhancing it, because you're going in with the moisturizer already absorbed and you're just using it on its own. And then in the morning, you just want to cleanse and use your SPF moisturizer. Keep your skincare very basic with just moisturizers and cleansers, and let that retinol do all the work for the first 3 months, because that's about how long it takes for you to truly see the benefits of using retinol. All right, guys, let me know if you try this retinol staging technique. I'd love to hear from you, and share this with a friend who may also be struggling with using a retinol. Until next time, bye guys.